you see that our skin quality will be poor, and also the soft tissue will be atrophy. Some are hypertrophy, like in the eye bag, or in the jaw fat, or in the nasolabial fold. So this is where is hypertrophy. And also you will see the lines and the fold, and also the downturn of the corner of the mouth and downturn corner of the eye, and also the sagginess that you can see. But we don't aging only in the skin. We also aging from the deeper part to the superficial part. So this is my most favorite slide because Dr. Vorapot created. We divide our face into 5 layers from bone to the skin. And when we aging, we will aging from bone and retaining ligament. We will use the dermal filler as all of you familiar with it. And for the facial expression muscle, we will use the neurotoxin to inhibit the muscle, and also we use the filler to facilitate the muscle. And for the superficial fat, we also have the many procedures that we can treat with this layer, and also in the skin too. But there are 2 groups of the pattern of the aging. As yesterday, Dr. Atinut already said about this. From the paper of the Arthur Swift from 2020, we divide the patient into 2 groups. The first one is when they aging, they have the hollow and the sunken. We call this single type. The another one is have increase in the volume, so we call it the second type. And when we divide our patient into 2 types, we will decide to treatment them in 2 ways. The first one for the single type, we will use the lifting and volumization. But the other one, we use the lifting and volume reduction. Today I will focus on the lifting and volumization. But if you like to know how to treat with another type of the second type, you can follow the topic again in next, okay? Now, as I mentioned before, we have 5 layers of the skin, of the face, and the bone and the fat. So we always use all of this. But in Thailand, we have the Outdoor V Aesthetic training team that we create a systematic treatment for all of these layers. It's called TI for dermal filler, TIZ for biostimulator, TZ for dry derm, and also PDZ for biostimulator for 100. We have about 9 codes for TI, 7 codes for TIZ, 3 codes for dry derm, and also 6 codes for TDZ. So today I will focus only one, okay? Now, what is the C code? The C code is conform, safe, easy, and effective. We will start with the first one, the safety. As we listen many talk of the speaker from yesterday to today, we will always talk about the granuloma, right? So the granuloma is the chronic inflammation that will be about 6 months that we will see the granuloma. So what is the factor of this granuloma formation? It's divided into the first one is about the type of the biodegradable polymer that Dr. Confesta said yesterday, right? So for PDO, it's only 3 months for degradable, so it's very safe. The another thing is the surface smoothness. For PDO, there are very smooth round surface, which is safety and not not stimulate the collagenesis much, and they have the hydrophilicity, so it will not cause much of the inflammation process. And another thing is about the particle size. What is its cost? If we look at the microphage, it has only 21 micrometer. And when we inject something into the skin, what it costs? If the particle size is less than 10 micrometer, it can digest it all. So it not cause much of the inflammation. But if the particle size is about around 10 to 100 micrometer, they will call another cell to phagocytosis, and it will release the extracellular matrix for making its inflammation and have the stimulate of the collagenesis. Okay? But how about more than 100? Even though it called that brain come to phagocyte, it cannot phagocyte all. It will leave the particle site and induce the chronic inflammation more than 6 months. So this is why it causes the granuloma. Another thing is about the concentration. Even though you use the particle size about 10 to 100 micrometer, but you have the very high concentration, it also causes the granuloma formation too. So for PDO microsphere, we have the paper that this concentration will cause no granuloma formation. So if you like to use the PDO microsphere, I think you should reconstitute in this concentration. This is for ultracold 100, and this is for the ultracold 200. The another three factor is about the sterile technique and the technique for injection and also the volume. So I think all of you that understand this, you can use this safely in any product. Okay. Now I will move to after safety. We will see that what is about the easy. The easy is about the very easy technique for use. So I will bring all of you to understand that if there are the area of the hypertrophy, we will use the reduction, right? But in the atrophy area, we will use the volumization technique. So this is the picture of our cadaver that we have in, we held an international workshop for the cadaver last year at Paramangkutgang Hospital in Thailand. And I invite all of you that join us in this year. After we peeling of the skin, we will see that there are the yellow sheet with the continuously. But if you injection the product like a filler or the biostimulator, you will see that the product will confine into the area. So this is not the yellow sheet that continuous. They have the septum between. So we can define for the forehead to 3 parts, for the periorbital for 3 parts, and also for the mid-face in the 3 parts. And we have the superior jaw, inferior jaw, and preparticimal fat pad. Now, we have the easy technique, and as I talked before, right? We have the technique for easy. For ultracold 200, we have 7 zones. And for rider, we have 3 zones. So today I will focus only in the ultra-core 200. I will bring all of you back to when you are the medical student. This is our outline for today. We will start with the chief complaint of the patient. And we take the history taking, physical examination, diagnosis for the treatment plan, and we always use the prescription. But for us, we are the injector, so we will injection, not prescription. Okay. Now I will have the timeline here for you to easy understand that what is the systematic approach that I would like to talk about today. First, we will have the history taking first. There are the routine history that you have to ask the patient before, okay? But for injection, we have the specific history. It's called 4C method. The first one is about the patient concern, and the cause, and the clock, and clarity. This is the thing that I invite all of you to do like this. But if you like to know it in deep, I suggest all of you to join our webinar, okay? And for the physical examination, we have the routine examination. And also, we have the specific examination. It's called aging sign. So let me start one example. This is the patient for 53 years old. Can you see the aging sign of her? Which one? Yeah. Oh, I see many people like this. Okay. Yeah, that's right. The first thing that is about the sunken temple. Another one is lateral brow ptosis. This is the first 2 aging signs that I see from her. And then we will get it into the indication for temporal zone. So this is why we injection here for lifting, and we would like to correct the aging sign for her. And this is the all of the aging sign that I see from this patient. She has 9 signs. So after we have the aging sign, we start to take a diagnosis from this. This is all the indication that we can use the target injection zone for treatment the patient. And this case, you can see that this is the 9 sign that I already examination from her. So we don't have to think about what the zone that we would like to treat. You can take this note and tick it. It's easy, right? And then for the treatment plan, we have the code like this. This is called the flashcard for treatment. This is the name of the zone and the product we use, the technique that we use for the cannula or for the sharp needle. And this is the recommended dose for each area that we treat. And also we have the alert structure that we have to aware when we injection. And then when we going back to our patient, this is the treatment plan for her. We have the 6 layer. Okay. We have the 6 area that we will treat for her with the recommended dose. So it's equal about 4 milliliter per side of the patient. So in this case, I will use 8 milliliter for her. And now we will see the injection technique. Okay, may I move to this side? It's better. Okay. When we reconstitute, as I talked before, 1 vial of the PDO microsphere, we can have it for 4 milliliter. So in this case, I will use 2 vial for her. And this is the protocol that we treat her. The first time, we use 2 vial. And the second time, we're waiting about 2 months for another 2 vial. And for 4 months, we will use another 2 vial. And then in the 1 year, we will do another 2 vial for her. This is the treatment plan for her. Let's see the how-to injection. We will mark first at the temporal crest and the orbital ring. And then we make an entry point. And we use only 0.5 milliliter for ultra 200 and make a retrograde fanning technique for her. You can see the depth of the cannula is not deep. We use in the superficial subcutaneous layer. Okay. And then we always mark for the alert area. And you can see that it's very easy for injection. This is the cheek and infraorbital area, so you can inject it in the pre-palpebral part of the orbital. And this in the subzygomatic area and the jaw area, and also in the nasolabial fold area and labial mental zone here. We can treat all in whole face of her. It's easy, right? For example, if you do this, if you go too deep, it will cause 2 injection into the facial artery. So please aware. This area will help for the marionette line too. Okay, I will let you see just only one side, okay? Because of time. So after we use it, safety, easy, and then how about the effectiveness? This is the after we injection in that day. In the day of the injection, you will see that she improved in the lifting, and also in the infraorbital area is fullness, and also in the nasolabial fold and the marionette line is improved. And if you look at her whole face, you will see that she has a very smoothness of the facial shape. Some of you think this about the temporary result from the lidocaine or sterile water. So let's see how about 1 month after. She will look natural and she has the fullness of the face without too much of the volume. It's not like when we use the filler. It looks more harmonized. And also when we focus into the area, you will see that the temple is fullness. And also the infraorbital area is lifting. And see, at the jaw is lifting too. So if you look into the skin, you will see that the hyperpigmentation is improved too. And how about the another case? This is the second case. How we diagnose for her? We see that there are the 9 signs of the aging sign, as I told before, right? And then we go into the flashcard and then we make the diagnosis for her. Then this is for treatment her for 6 area for about 6 ml. But this case, I would like to show you that if the patient is not afford for the cost of the treatment, we also can treat her with a half dose. Let's see. She come with friend and one vial have 4 milliliter, right? And now she come with friend and divide into 2 person. So she get only 2 ml per person. So this case, I treat only 2 ml. Let's see the result. I always do marking like this. It's easy. We will do it. We repeat, do it every treatment. Then it will be automatically for treatment and make it easy for you. I use only 2 areas, right? Just temporal zone and the infraorbital zone. And I do the same thing in the another side. Please notice, take a look at the depth of the cannula. It's not deep, it's very superficial. Let's see the result. This is the immediately after. You can see that it looks more natural, and the infraorbital zone is better for just 2 cc for her. And this is the picture from the MetaView, the device that make the 3D picture. Okay. This is after 1 month. You can see that I use only 2 ml for her, but her face is look more slimmer and lifting her jawline. And also she has more V shape of the face without inject any chin augmentation. In the another view, you can see that she has improved of the jawline without injecting anything here, right? And I didn't inject at the subzygomatic area, just only in the infraorbital area and the temporal area. That's all for her. So I would like to invite all of